who are at high risk in COVID-19. So we all knew that diabetes, hypertension, immunocompromised patients, or like those who are having the certain hormonal diseases, cardiac or lungs or kidney diseases are at high risk. It's been very popular all through the time. So regarding these particular group I have mentioned being in high risk, it's been well noted among the scientific community or else even the common man. But what we usually forgetting and what we are not aware of that is that those who are having allergies, like asthma, bronchitis. Of course, asthma, bronchitis are having very less risk compared to the psoriasis or arthritis or other autoimmune diseases. What is happening in certain strains of corona, hyperimmune reaction is being the main problem, main culprit that is causing the cytokine storm, hypercoagulation, and the hyperinflammation. A body, the blood is being rushed with all the inflammatory mediators. So the vasculitis, it's provoking vasculitis and small clots. So these clots are occluding in the alveoli, and finally the oxygenation is getting down. The blood vessels are being into the inflammatory state, and sometime to the extent it is mimicking a cardiac arrest, myocardial infarction, and the patient is ending up in cardiac arrest. Of course, added the cardiac blood vessel or blood vascular inflammation added up with hypoxia. So this is the thing what is happening. So of course I've been too much into the medical line, but this is what that's happening in the COVID-19. So the people who are having the inflammatory diseases or autoimmune diseases whose body is having a tendency to react in a hyper manner to anything sometimes are at high risk. So take it like you don't believe, even though we assume that female are at low risk, the females having PCODs are considered to be high risk, and there are clear studies regarding that. There are some studies that mentions like the relation of testosterone and hyperimmune reaction. So the rugged men are falling at higher risk in COVID-19 when it comes to the hyperimmune strain, obviously. So these are the things that we need to note about that.